Welcome to Zotec Answers, the podcast where we break down the policies and trends shaping healthcare today. I'm Jennifer Fox, Director of Compliance and Advocacy Communications at Zotec Partners. And today I'm joined by two of my Zotec colleagues, Mark Isenberg, Executive Vice President of Healthcare Advocacy, and Megan Applegarth, Manager of Client Advocacy and Government Affairs. In this episode, we're going to discuss recent news out of Indiana regarding changes to a well-known downcoding policy. The question we'll be answering is, how will Indiana's policy update affect physician reimbursement? Mark, thanks for joining us today.
Sure.
So what is the situation in Indiana in terms of Anthem's Medicaid downcoding policy, just in general terms?
In general terms, we started noticing probably in the 2023, 2022 era where they were using a specific set of final diagnosis codes in order to downcode emergency room visits. So essentially what they were doing is saying, okay, if I, Ed often uses this comparison, I wake up with kind of a tight chest and I go to the ER and it turns out that it's indigestion. So that final diagnosis code, even though I, as a physician, did the full workup necessary to rule out anything that was probably more severe, would be paid at a lower code. So they're arbitrarily taking into consideration the final diagnosis, even though, under the prudent layperson law, and EMTALA, that the physician absolutely had to do what they did. They're essentially saying, well, you shouldn't get paid for it because the patient wasn't as sick as they could have been. So that is what we saw happening in Indiana. But I'm happy to kind of talk about the precedent that followed that in Virginia, which I know we've talked about and we've had podcasts, I think, on the past. Yeah. But they were really the ones that, challenged the Medicaid system there. It was in 2023 that the opinion was issued by the court in Virginia. There was a lawsuit there that essentially all of the House of Medicine, including the hospitals, went to them and said, hey, guys, this is in violation of the prudent layperson's law.
Right.
And the court agreed with them, and they actually won that decision. And I think they went after back money as well, but I'm not sure if that has actually been resolved. But they were able to seek remedy in the court.
Yeah. Well, Anthem's claiming that they are targeting outliers to ensure coding accuracy, but the statistics show that up to 70% of emergency medicine claims have been affected by these reductions. So where is the line between valid fraud prevention and a corporate algorithm that's overstepping clinical judgment here?
Well, I mean, it's a multifaceted problem, right? I mean, they're hired by like the state of Indiana to facilitate the management of the Medicaid program.
Sure.
Right? So I'm not quite sure how their contract is structured with the state of Indiana. Is there cost savings associated with it? So is the state trying to reduce the Medicaid spend? Yeah, I can tell you that most states are trying to reduce Medicaid spend. So part of me thinks that there may be some type of contractual relationship that is forcing this, this policy. And it may be a cost sharing side whereby if Anthem is able to reduce the overall spend, they get part of that upside. The challenge is that you have to do so and not impact clinical as well as, rightful compensation to those that are providing services. Sure, if there's fraud, you need to go after that. You need to eliminate that. Yeah. But when it starts moving past that, then it becomes, a real issue.
Yeah.
If you had to put yourself in the shoes of a physician or some of the physicians you've talked to, obviously we know this has a financial impact on their business, but does this have an impact on like the morality of it? Like, physicians are trying to do their job and then they get hit with things like that. What does that impact look like?
Yeah, I mean, keep in mind that these are the ER docs that are working 24 hours, and they're the last, unfortunately, a lot of Medicaid patients end up, all right? I mean, it's not, they should be the last resolve, and they should try to make sure that they're seeing their primary care, and they should maybe try to go to an urgent care if at all possible. But at the end of the day, they don't normally keep up with steady health care. So, they do go to the ER, and it's unfortunate. And I understand why the state would want to try to limit as much as that as possible because it is the highest cost side of care. But at the end of the day, these physicians are there. They're doing their jobs. If they didn't do their jobs and they said, well, no, I think that's heartburn, go to the urgent care center, and then that patient turns around and has a massive heart attack, then there's massive liability on the healthcare system and the provider. So, you don't want the ER docs having to make those types of decisions, which is why, EMTALA exists. And it's why, the PLP exists to protect the payment side of the equation for them.
Yeah, absolutely. And now just to kind of step into AI a little bit, we saw Indiana and a plethora of other states pass AI-related legislation in terms of regulating AI downcoding this year and in years past. So do you feel like those new laws go far enough to protect physicians, or do you still see some major loopholes being exploited at the hands of payers?
Yeah, it remains to be seen. I mean, we're also hearing that noise around prior authorizations and facilitating more streamlined through use of, more stringent kind of structures and trying to facilitate less of an administrative burden, both on the front end and on the back end with denials. But, the proof is in the pudding, and we need to see what they actually do. You look back historically, and what happens, generally speaking, is that lawmakers, both at state and federal levels, will float laws guided at trying to get carriers to behave in a better fashion. And then 2 weeks later, there's this press release proactively, lauding them, saying that they are, moving forward to voluntarily comply with these things. So, it's just a bunch of, back and forth. But at the end of the day, we all know, and I hate to say this, but, carriers are profit focused, and they're going to have to figure out a way to protect their bottom line for their shareholders and for their, for their corporation. And all the federal and state governments can do is to try to level the playing field as much as possible.
Yeah.
The ironic thing too is that in Anthem, and just to be clear, we had this problem. We had a huge joint lobbying effort with Indiana ASAP and our clients to make this, known. And Ed and I, in fact, met with Governor-elect Braun at the time and his healthcare legislative aide to discuss this issue with them and to point to the Virginia lawsuit and basically say, what's going on here? What are you guys doing? And then we also had various meetings with FSSA, with our clients, with Indiana ASAP, with other members in the medical community. Right. And I think that our ask was received, or I think the threat of a potential lawsuit was very well aware, and you could point to the Virginia one. So we have fortunately seen that effort of downcoding in this particular case subside, if not completely kind of go to the wayside. So that is the positive side of the equation. And it's also kind of indicative of what a true lobbying effort is, kind of bringing in everyone that all the resources that you can access, and just making them aware that, this is a legitimate problem. It's impacting potential access to care, even though you and I both know that ER emergency physicians aren't going to close their doors. They're going to see patients because they do no harm. But, at the end of the day, it's just the fair and just thing to do.
Yeah, and I think that shows too how this has really been a multi-year long advocacy process, and what worked in one state now has to be done starting from ground zero in another state. So advocacy is definitely a long game in an issue like this.
Yeah, and another funny thing is that in 2022, Anthem had to pay the hospitals through an arbitrator $4.5 million, and the reason they had to pay him $4.5 million was this exact same reason. Right. They were getting downcoded on the technical side of the equation. So in 2022, they knew it was illegal, and then they continued to do it until you had to have the pushback on it. And they're actuaries. Okay, so if we get caught, what's it going to cost us, and how much can we save? And at the end of the day, they'll continue to do what they're going to do. So that to me was the most blatant sign that they knew what was wrong. They'd already been sued and found guilty of doing it.
Yeah, I mean, but that just goes to show how important it is to continue to advocate and continue to watch what's happening and, protect the business of healthcare, because at the end of the day, this isn't going to go away. Right.
Right.
They're just going to get smarter. And I think with new AI things in place and things, I think the game is going to get even more interesting as we continue to do this work.
Yeah, and one other ironic thing in terms of, and I know we all experienced it because we had to educate all of our physicians on the coding changes that took place on, E&M guidelines for emergency physicians that went into effect January 1st of 2023. that was designed to try to reduce the burden of physicians having to go through kind of bullet points and, comment on the history and exam components and the complexity of the medical decision making. And that all kind of switched over to just, talk about the medical decision making or the total time that they were taking with the patient to teach our AI engine and the coding side of the equation to educate our physicians. But then these carriers didn't comply with it. And they used it as a way to further deny or downcode these claims. And, the state of Indiana wasn't even using those standards, which was Anthem wasn't using it on behalf of the state of Indiana, which to me was just absolutely crazy that, they're not held accountable to using those coding guidelines for payment, but yet we're responsible for doing it from a compliance standpoint. So it just shows how what was kind of thought to be a win for emergency physicians by reducing the time and effort of the reporting actually turned out to be used against them in an effort to maintain their profit margins.
That is it for today's episode of Zotec Answers. A big thank you to Mark and Megan for all your insights. And thank you for listening. If you enjoyed this episode, be sure to like, subscribe, and share the podcast. And if you have feedback or a topic you'd like us to cover, you can reach us anytime at zotecanswers@zotecpartners.com. Until next time, stay informed, and most importantly, stay engaged with your lawmakers.